When you visit a remote community, you see more cases of ear disease, lots of eye disease, and lots of heart disease because of a lack of access for individuals to those services.
Our Starlight Healthier Futures initiative was created to support our Aboriginal and Torres Strait Islander children, and this program engages them and reframes their total healthcare experience.
It can be scary for anyone to go to clinic, let alone when the people there are speaking a different language. It sounds and feels different from what you're used to. So to have Captain Starlight there to make it a child-friendly environment is so important. Plus, of course, it has such a positive impact on children's willingness to come to clinic.
It makes a world of difference. You know, the reason we go out to community is to keep those children, especially the Indigenous children, engaged and at the clinic for as long as possible so the doctors can see as many kids as they can. The most important part of community is going consistently. You know, they start to realise, okay, Captain's here, when I go see the doctor, I'll see the Captain as well. And that makes a big difference because they come with this anticipation that they can come and have some fun in the clinic while they're waiting to see the doctor. As an Indigenous person myself as well, I also know how important that familiarity is and that feeling of connection and just the smallest thing. Like, I've seen you before, you came out and saw me in community and played footy with me. And we've had stories of kids that go from Maningrida to Darwin to Melbourne. This child keeps seeing the same people that are there to offer this consistent support, and I think it just takes so much pressure off the parents or the aunties or the carers that are with that child, knowing that Captain Starlight's there every step of the way. There's over 60 communities that we reach in the NT. Each culture presents a different sort of set of circumstances, and a lot of times there's language barriers, so you might have lots of different tricks or wordplay that you might use in Sydney or Melbourne. You come up here and it doesn't quite have the same effect, so you'll try different tactics, and kind of what makes it special up here. It's very unique.
The Healthier Futures program operates in any community where it's needed, and at the moment we have a really strong presence in the Northern Territory as well as Queensland, South Australia and WA. We've literally seen sliding doors moments from a child heading out of community the day clinic arrives, seeing Captain Starlight and saying, "Oh, Captain, I'll come back to clinic now." And then that check that the health professionals do, diagnosing something early that they can then treat fairly easily. If that had just been left for another year, it would have become a serious, chronic, lifelong condition.
If we can get that diagnosis and encourage the kids to come and be examined, we can have kids that are then diagnosed and treated versus children who either die of rheumatic heart disease and that no one knew they had, or become deaf because they had meteorotitis and a middle ear infection that wasn't diagnosed and treated. I remember being in a community in Yurikala, and our captains were singing songs to the kids about blowing their nose and washing their hands. There was a strong woman from that community, and she said to me, "The Captain Starlights are teaching our children these songs, and then these children will teach their children." Can you just imagine that even a tiny amount that Starlight was contributing to generational change in terms of the healthcare outcomes for these children and families?
We understand from our research and evaluation, for example, that not only do our programs bring happiness to children, but they actually bring it to health professionals too. When Captain Starlight comes on our Healthier Futures trips, they find it easier to have the children involved in those healthcare checks. They find the children are more willing to hang around between appointments, which can often be long and tedious, but they're having so much fun with the captains that they're like, "Really? Oh, of course, I'll stay."
Kids are coming and they're getting something unfamiliar, they're getting a scan, for some of them are finding out that they've got signs of rheumatic heart disease, and to have that in a context where they're made to feel really comfortable, they get to play, do some activities, and the captains honestly just make the whole thing work.
I think the biggest indication is the way that families and communities want us to come back. We are there at their invitation, and they absolutely ask, when can we come back and make it a permanent feature of their clinics?
You look into that child and you're like, what does this child need from me right now? And if you're allowed to go into their world, their imagination, will take care of the rest. So to be able to do that in an Indigenous sense, you kill two birds with one stone. You connect with the child, but then you also build this trust that's just missing at the moment, and it's been missing for hundreds of years. So we get the opportunity to just make a tiny dent in that. You start drawing with a kid, and then maybe one day they'll go and get surgery when they weren't going to get it initially. That's the potential of what we do, which makes it worth it. Hopefully one day we're at every community in the country.